First story of the day. Sepsis. Who likes sepsis? Sepsis. It's a scary disease. If you don't know what sepsis is, it's basically when an infection takes over your whole body, starts shutting down some of your organs, and you end up dying. And the problem with sepsis is it's really hard to catch, because by the time you catch it, it's already in your bloodstream all over your body, and then trying to stop that, they have to hit you with some hardcore antibiotics, and a lot of the time that itself doesn't work, and it ends up taking a lot of people's lives. So what are we going to do to stop sepsis? This is a way us nurses can get a jump on the sepsis control. So the way that we're going to fix this issue is that nurses are going to work closely with the technology around us, meaning our computers, meaning our EMRs, our medical record systems, whatever you use that gives you a ding, gives you a reminder that this medication is due, gives you a reminder that you need to do this task. It is going to remind us, or it's going to give us a little ting, a little ding, whenever the computer suspects that a patient might be becoming septic, or has septicemia, or is septic. They have devised a system that uses more subtle clues from a patient's day-to-day electronic health records to send up warning flags of impending sepsis. The automated system looks for patterns and symptoms like high temperature, low temperature, low blood pressure, fast breathing, and high white blood cell counts. No single symptom signals sepsis, but certain patterns suggest this condition could be emerging. So once the computer gets all this information, and it sends you that ting, that ring, that reminder, that concern, that red box, that red check, that X mark, whatever it uses, once it reminds you, it is up to us nurses to decide if this is worth calling the doctor, if this is worth notifying the doctor. So it says, if the nurse says yes, that this is something worth notifying the doctor, then the provider is automatically paged out of the computer system. The doctor is supposed to respond within half an hour, and the overall goal is to get a patient who might be developing sepsis antibiotics within 3 hours. So the good thing about this is that it asks the nurse, and it's not pinging and paging the doctors every 5 seconds, because we've all been in situations in which we've taken a patient's blood pressure, a patient's heart rate, when they just walked up the stairs, when they just ran to the bathroom, and it was sky high. And if they were paged because the patient was walking to the bathroom, jumping up and down, doing something physically active that got that blood pressure and heart rate to go up, it'd be useless. And then we would stop listening and paying attention to the pages. That's why it needs to ask us nurses, is this like an unnatural cause? Is there something going on with this patient that you don't understand, or you don't know, or you think sepsis might be going on? Then you page the doctor. This computer system lets us know if we need to page the doctor, or if it's concerning enough that the doctor needs to be paged, the doctor will then get paged. And once the doctor is paged, hopefully within 3 hours, they get antibiotics, and this cuts down the death count. It's huge. Sepsis is a disease that's killing 250,000 Americans every year, and that is just in America. I know us nurses, we deal with alarms, bells, pings, dings all day, every day. And it is super annoying, and it is super frustrating. And I know alarm fatigue is an actual thing, it's a real thing, it's a frustration. But if this extra one more ding can help save 250,000 people, even a percentage of that number, I am all for it, all day, every day. Ring, ding, and ping all you want, all right? All you want. At least that's how I feel.